Welcome all. Today we are going to discuss how to examine a chest X-ray. So what are the first requisite to see a chest X-ray? At first you have to tell it is a PA view or AP view. It is written in the X-ray itself. Okay. Here it is the PA view. Okay. After that you have to determine the side of the X-ray. At first the right or left side is written on this X-ray itself. Here it is the right side. If the side is not determined in the X-ray, you have to see some other features. What are the structures you see to side determine? At first, the apex of the heart is usually seen in the left side. Okay, here it is the apex of the heart. After that, so it is favors the left side, and it is the fundal gas. Okay, gas in the stomach. Okay, it is the fundal gas. So fundal gas is usually seen, and fundal gas is seen in the left side. Okay, although apex is not seen in the left side in the dextrocardia, but dextrocardia is very rare finding. Okay, so what are the findings? At first the apex of the heart, apex of heart, then the fundal gas. After that you see the right dome of diaphragm. Okay, it is the right dome of diaphragm, is the left dome of diaphragm. Right dome of diaphragm is slightly upper. Right dome of diaphragm, okay, is slightly upper, and it defines that it is the right side. Okay, then you see the aortic knuckle here. Aortic knuckle is usually seen in the left side. So these are the key features. By this you determine the side of the X-ray. After the side determination, you have to see the peripheral area, means any bone deformity or not. These are bones, any breast shadow present or not. Okay, then you have to come in the lungs and the heart. Okay, let's see the how the breast shadows look like. See in this X-ray, here it is a shadow, here it is a shadow. Okay, so these are not any abnormalities, it is the breast shadow. Okay. Then after the side determination, you have to see the X-ray is taken rightly or not. To see this, you have to first identify the spinous process. These are the spinous process. Okay, so make a line here, and after that you have to make line, which means these are the spinous process. After that you have to find the medial end of the clavicle. Okay, so here it is the medial end of the right clavicle, here it is the medial end of the left clavicle. It is called A, and it is the B. A and B. So length of A, that means the diameter of A and B is almost same. So this X-ray is taken in the right position. Okay, but see in this X-ray, here the spinous process means here it is the medial end of the clavicle, and here the medial end of the clavicle. Here is the A and it is the B. In this X-ray, B is greater than A, means it signifies that the patient rotates towards the left side when the X-ray is taken. Okay, then after that you have to see the X-ray is taken in the breath holding position, or means the inspiratory position or the expiratory position. After that you have to see the ribs. The horizontal ribs are the posterior end of the ribs. Okay, posterior end, and the oblique ribs are the anterior end of the ribs. Okay, after that you have to assess the cardiac size. How it is calculated? It is done by the cardiothoracic ratio. So A by B. A means the maximum transverse diameter of the heart, and B means the maximum transverse diameter of the thoracic cavity. So here you have to first see the midline. It is the midline, and here the maximum transverse diameter of the heart towards right side is called A1, and here the maximum cardiac size cardiac transverse diameter is the A2, okay, and here the maximum thoracic transverse diameter is called B. Means A by B means A1 plus A2 determine the maximum transverse diameter of the heart, and it is the B is the maximum transverse diameter of the thoracic cavity. In the PA view, of a normal cardiac heart sized patient, it is almost the 0. less than 0.5, okay. In the AP view, this ratio is slightly greater, means almost the 0.55, okay. If in PA view the ratio, cardiothoracic ratio is greater than 0.5, then it is called cardiomegaly, okay. After that, the examiner may ask you what are the chambers and where it is located, okay. So this is the right atrium. This is the right atrium, okay. It is the left ventricle, and here in this position it is the left atrium, and in this position it is the right ventricle, okay. So these are the 4 cardiac chambers in this X-ray. After that, the examiner may ask you what are the left sided boundary and the right sided boundary of the heart in this X-ray, okay. So see the boundaries. Here the superior vena cava, okay, it is, we tell earlier that it is the right atrium. Then this is the inferior vena cava, okay. In the left side, here you can see the aortic knuckle, okay. This is the main pulmonary trunk, okay. This is the main pulmonary trunk. It is the aortic knuckle, and here it is the main pulmonary trunk. It is this small area is determined the left atrial appendages, okay. It is the left atrial appendages, and this is the border of the left ventricle, okay. So these are the left and right borders. And you all know that the right sided lungs has 3 lobes and the left sided lung has 2 lobes, okay. It is the left upper lobe, it is the left lower lobe, it is the right upper lobe, right middle lobe, and right lower lobe. This is important in the lobar pneumonia, okay. Now we see few X-rays. So let's start. This is the X-ray 1. You have to first see it is AP view or PA view. It is the AP view X-ray, okay. It is the AP view X-ray. It is written here. Then the side determination. It is the right side is also already written in this X-ray. After that, it is taken in the right position or not. Here is the spinous process, and it is almost in the middle, so it is taken in the right position, okay. After that, one important thing, what is the costophrenic angle? Here it is the angle between diaphragm and the ribs, okay. It is acute angle, means the less than 90 degree in the normal patient. But see, in this patient, in the left side it is acute, but in the right side it is not acute, it is obliterated, okay, or blunting of the costophrenic angle. It signifies that in this position there is some fluid, okay. So it is a case of pleural effusion, okay. There is 2 types of pleural effusion presentation. One is like this, means S-shaped. It is called Ellis's S curve, when the highest point is on the lateral half of the hemithorax, okay. And other presentation that sees in this X-ray, it is this. So this presentation is called pleural meniscal sign. Pleural meniscal sign, okay. These are the 2 presentation of the pleural effusion, okay. So what is the diagnosis in this patient? It is male right sided pleural effusion, mild right-sided pleural effusion. Then the next X-ray. Let us see the AP view or PA view. It is PA view and it is the right side. Okay. And after that you see the position of the trachea. Trachea is shifted towards right. Okay. So as the trachea is shifted towards right, and here it is the consolidation, severe consolidation to hold the right-sided lung. Okay. So what is the finding? It is tracheal shift towards right side and right-sided consolidation. Okay. So it is probably due to right-sided pleural effusion with same-sided shifting of trachea. Okay. And if the consolidation means if the pleural effusion and the trachea is shifted towards same side, the prognosis is very bad. Then X-ray number 3. In this X-ray, at first see the PA view, and here is the apex, is the X-ray. So it is the left side. Okay. As it is the left side and it is the right side, see the position of the trachea. It is almost in the middle, so it's taken in the right way. But see the tracheal position. Here the tracheal position. Okay. And here the radiopaque area. Okay. It is looks like fibrosis. Okay. So what is the diagnosis in this patient? It is the left-sided fibrosis of the lung. Okay. Left-sided fibrosis of the lung and upper lobe of lung is pulling up the main bronchus. Okay. As the fibrosis occurs, it pulls the left bronchus towards upper side. Okay. Next, see the fourth X-ray. In this X-ray, it is the right side and it is the PA view. Okay. See in this area, it is probably the encysted effusion. Okay. And this is a atypical type of pleural effusion and it is called the lamellar pleural effusion. Okay. So what is the diagnosis? It is the left-sided pleural effusion. Now see this X-ray. In this X-ray, it is the PA view X-ray and it is the right side. Okay. The right side, the lung is present. Okay. There is lung tissue. These are the lung tissue. But see in the left side, here darkness and this darkness is different. Okay. Here you can see there is no lung tissue. Okay. So there is no lung tissue means it is a pneumothorax. Okay. So there is no lung tissue, so it is a pneumothorax, and here you can see the air bronchogram. Okay. The air bronchogram, which is the air bronchogram is seen in the pneumonia, and here it is the left-sided consolidation. Okay. Left-sided consolidation. So what to tell? Here it is the left-sided consolidation with left-sided hydropneumothorax. Okay. And air bronchogram is also seen, suggestive of it is a case of pneumonia affecting the left sided of the lung. Okay. Now see this X-ray. Here it is the right side, it is the left side. Okay. And see these are the fibrosis of the lung. Okay. These are the fibrosis of the lung. So here you can find fibrosis of the lung and count the ribs. Okay. Count the anterior ribs. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay. So greater than 7. If the ribs are counted is greater than 7, then it is called the hyperinflated lung. Okay. So it is a hyperinflated lung with fibrosis, and see the heart is narrow. Okay. Typically heart is not so much narrow, but in this X-ray the heart is narrow, called the tubular heart. Okay. Or narrow heart. So what are the findings in this X-ray? It is a X-ray of PA view, and you can find fibrosis in the X-ray with hyperinflated lung because 9th ribs are counted, and here the tubular heart or narrow heart. So what is the diagnosis? It is probably a patient of COPD. Okay. Let's see this X-ray. In this X-ray, it is the right side, it is the left side, and what is the abnormal finding in this X-ray? This portion. There is a radio opacity in the right sided lung. Okay, maybe due to some mass or granulation tissue. Okay, probably not, it is not probably the abscess, because abscess looks like this, but here it is probably mass or granulation tissue. Now see in this X-ray, here that is right side, it is left side. Okay, it is the fundal gas. Okay, and what is this? It is not any consolidation, it is the breast shadow. Okay, it is not any abnormal finding. Okay, now see here the lung tissue is present, here the lung tissue is present, but some abnormalities in this area. Okay, so in this area there is a consolidation. So the consolidation in the right sided lung, and it is probably, and here you can see the ear bronchogram. Okay, ear bronchogram. So consolidation on the right side with ear bronchogram is suggestive of pneumonia, and probably it is it looks like lobes, only one or two lobes are involved. Okay, right lower lobe and right middle lobe is involved in this patient, so it is probably a lobar pneumonia. See in this X-ray, it is the right side, it is the left side. Okay, now see severe consolidation on the right side. Okay, so it is a right sided pleural effusion. Okay, right sided pleural effusion, and see here it is the breast shadow. Okay, it is the breast shadow, and see the costophrenic angle in this left side, costophrenic angle is obliterated. Okay, so it is probably a bilateral pleural effusion. Left side is totally gone, right side is totally gone, left side also the costophrenic angle is obliterated, so it is probably a bilateral pleural effusion. Let's see in this X-ray, here the left sided lung is totally radio opaque. Okay, means here it is pleural effusion. Okay, and see the trachea is shifted towards the affected side, means associated, it may be associated with any lobar collapse. Okay, and mainly it is the absorption collapse due to, maybe it is due to endotracheal TB or endobronchial TB or endobronchial mass. Okay, and what is this? This is a Ryle's tube. This is Ryle's tube. Okay, so what is the diagnosis? It is right sided pleural effusion with trachea shifted towards same side. It is a red flag sign and prognosis is bad. Now see in this X-ray, this is right side, this is left side. Okay, and it is the dextrocardia. It is a very rare finding. So now see in this X-ray, the trachea is shifted towards the right side. Okay, it is the breast shadow, and it is the colon. Okay, colon mass, and you can see here is something radio opaque area, so it is probably a hilar mass, and due to hilar mass it pushes the trachea towards right side, so it is a left sided radio opaque area, probably a hilar mass, and trachea shifted towards opposite side. Okay, now see in this X-ray, ICU patient. In this X-ray you see diffused radio opaque area. Okay, diffused opacity and fibrosis all over the lung, and little bit cardiomegaly is seen. Okay, cardiomegaly is seen. So these are the findings of COPD patient, and here it may, due to COPD, it may develop sepsis, and then he or she develops the bronchopneumonia, bilateral bronchopneumonia. Now in this X-ray, it is right side, and here it is something, it is a lung abscess. Okay, it is lung abscess. It is not mass, because mass is not like this. It is a lung abscess. Okay, then in this X-ray there is left sided pleural effusion, right sided pleural effusion. Okay, and trachea shifted towards right, so it is a bilateral pleural effusion. Now see this X-ray is the right side, and here the loss of the costophrenic angle. Okay, it is the breast shadow, so loss of costophrenic angle means it is a right sided pleural effusion. Okay, now see this X-ray. in this X-ray, it is the left side, it is the right side. Okay, then you can find that here it is a change, here it is a line. In the medial side of the line there is lung tissue, here it is lung tissue, but the lateral side of this line there is no lung tissue, means here it is air. Okay, so it is a left sided pneumothorax. Okay, it is the air and it is the border of the lung. Okay, it is the border of the lung. And what is this? It is not a border of the lung, it is the scapula. Okay, it is the border of the scapula. You have to differentiate. Here is the border of the scapula, but here the border of the lung. Okay, so it is a left sided pneumothorax. Now this X-ray, here there is no lung tissue. Okay, here it is lung tissue, here it is lung tissue. So there is no lung tissue. Probably it is a margin of bulla. Okay, maybe due to bulla rupture. Okay, so it is a rupture of massive bulla. Now see this X-ray, it is the right side, it is the left side, and here there is no lung tissue. There is no lung tissue. In this right side there is no lung tissue. In the left side there is lung tissue, but in the right side there is no lung tissue. And this area is consolidated and loss of claustrophrenic angle. Okay, and it is the fluid. Okay, and here you can see the little bit lung. Okay, it is the lung, collapsed lung. Okay, so what are the findings in this X-ray? There is collapsed lung, right sided pneumothorax with fluid, means hydropneumothorax. So it is a right sided hydropneumothorax. So in this area, when you percuss this patient, in this area you can heard a hyper resonant sound, and in the fluid area there is stony dullness. Okay, and you can find in this patient the shifting dullness. Okay, so it is a hydropneumothorax patient. Now see in this X-ray, here it is the lung, and there is no lung tissue. In this area there is lung tissue. So it is right side, it is left side. So it is a right sided pneumothorax. There is no loss of claustrophrenic angle, so there is no fluid. So it is not a hydropneumothorax, it is just a simple pneumothorax. So it is a right sided pneumothorax.